Welcome to this policy dialogue of the Johns Hopkins Pompeo Fabra Public Policy Center on the topic of architectural epidemiology. Thank you all for being here. I'm Dr. Mary Sheehan. I research and teach in the climate change, health, and cities space at Johns Hopkins and Pompeo Fabra and collaborate with the Public Policy Center. And I'm really delighted to moderate this session. As many of you know, the center regularly sponsors policy dialogues on cutting edge topics. This is the 15th such event. And if interested, you can find YouTube versions of past policy dialogues online on the center's website. And this session will also be recorded and will be available. So this event is a really very special one. And it's so great to see such a strong turnout. Architectural epidemiology is an exciting, new cross-disciplinary field that brings together architecture and public health. And it aims at nothing less than transforming buildings to support rather than detract from human and planetary health. So it's an ambitious and much needed initiative, particularly for the world cities, as we face both rapidly changing climate and risks to health. So I'm delighted, very especially delighted to introduce our great speakers. We're privileged to have with us today Adele Houghton, Dr. Adele Houghton as presenter, and Dr. Carme Borrell as discussant. Their talks will be followed by a question and answer session, for which we'll ask you to write in the chat to ensure we cover as many as possible. So I'll start by introducing our main presenter and the conceptualizer of this exciting new field, Dr. Adele Houghton. Dr. Houghton, or Adele, I'll say, is an experienced architect with a doctorate in public health, and so she's truly the embodiment of this transdisciplinary approach to this topic. She also teaches at the Harvard School of Public Health. She's a president of a consulting firm, BioC2, and has recently sent to press her new book on this topic. She also loves Barcelona, I should say, and has lived and worked there. And I've been really pleased and really excited to have worked in a couple of projects with her. So I believe indeed her new field will help change the world. And after Dr. Houghton speaks, should be followed by Dr. Carme Borrell, a preventive medicine doctor with a PhD in public health, and as many of you know, also executive director of the Barcelona Public Health Agency, where she's played a strong leadership role, including as partner of the center. And Carme has carried out extensive research on the social determinants of health. I was honored to join some of that work with her on the Mediterranean cities last year. And she's also a specialist in the field of housing and health, so we'll have a lot of relevant comments on Adele's presentation. So we look forward to Carme's observations as discussant. So without further ado, I'll turn the microphone over to Adele. And again, as we go along, please note any questions in the chat rather than in the Q&A button. Please don't use the Q&A because we'll miss them. And we will have a chance to have answers to those questions. So Adele.
So hello, everybody. It's such a pleasure to be here with you today. I wish I was with you in Barcelona, but here we are. And I would like to thank the JHU-UPF Public Policy Center, and particularly Dr. Mary Sheehan for inviting me to join you today. I'd also like to recognize my collaborator and co-author, Professor Carlos Castillo-Salgado from the Johns Hopkins Bloomberg School of Public Health. Professor Castillo has played an indispensable role in the development of all of the ideas I will share with you today, including coining the term architectural epidemiology. He's also my co-author on the book that Mary mentioned, and he's just an incredible collaborator. So appreciate all of his many years of working with me on this project. So I'd like to kind of start by introducing myself a little bit more fully. Mary did such a great job explaining, kind of my unique background, but I like to kind of start this way because it is a little bit different from many people working at the intersection of the built environment and health. I work as an architect. I'm a licensed architect. I also hold a doctorate in public health, and I've been working at this intersection of climate change, health, and the built environment for almost 20 years now. But I work at the parcel scale, and many people who work on this topic work at one scale or two scales larger than that. So a lot of people work on transportation systems, energy systems, floodplain systems. I work at the parcel scale. And the reason why I think this is important is because every time we design a new building or renovate a building or even change the activities within that building, that change to the built environment has a ripple effect on those larger systems. But unfortunately, the way that architecture and real estate development are practiced, there's usually a disconnect. So we don't actually talk about the larger systems and how what we're going to do affects those larger systems when we're designing, because we're really focusing inside the property line itself. And I'd like to give you an example of that by kind of walking through the way that current practice is today for people who work, that's architects, engineers, real estate developers, people who work at that scale of the property. We really look at the built environment from a case-by-case sort of piecemeal basis. So the way we start a project usually is by either responding to a request for proposals for a project that's already in a location, or a client will come to us and say, we have this idea for this building. We want to build a new building. We want to renovate a building. We want to change the way activities sort of move through an existing facility. Could you help us figure that out, right? And what that means is that we're looking at this kind of large and growing encyclopedia of different options about how we can respond to our clients' needs, but we're looking at them from the perspective of two components. What's the budget that the client has access to build that building or renovate that building? And what do the building code and zoning requirements for that property say we can and cannot do within those property lines? When we look at what's going on outside the property line, really what we're looking at is, where are the utilities? How can we get access to electricity or water or sewer? What does the zoning requirement say about the width of the sidewalk outside the property? But we're really kind of focused kind of internal to the site. And what we end up doing, if the client or the regulations require us to consider the natural environment, say climate change or public health, what we're doing is we're just trying to see how many of these design strategies that are available through many green and healthy building rating systems, how many of them can we cram into this project so we can get as high a score as possible? And we hope that that will have some sort of positive impact on these larger systems, whether it's climate change or health, social equity, economic development. But we don't actually know whether we're having that impact. And it could be that we're accidentally having a negative impact. And so I'd like to kind of share with you an allegory to kind of help you visualize what I'm talking about. And I call this the allegory of the medical clinic on the hill. I'm excited to see that there are people from all around the world on this call, people who work in urban settings and rural settings in the US and Europe and other countries. So I'd like to invite you to consider this allegory within your own context. So how might it apply to the context within which you work? And so let's just begin. If you imagine a new medical clinic that's located on a hill, people in the neighborhood are really glad to have that medical care close by. But they wonder if it was worth losing access to the fresh fruits and vegetables in the community garden that was paved over to make way for the clinic. They've also noticed that further down the hill, buildings have started flooding when it rains, and that the road to the clinic is now clogged with traffic. And so kids in the neighborhood are not playing outside anymore. The pollution and the danger of being run over are just too great. The point here is that the clinic owners did everything right. They followed all the rules, and the project even received a Green and Healthy Building Award. What they didn't do is considered how their project would impact the surrounding neighborhood's health and its vulnerability to climate change. And given the fact that the landowner and the design team had good intentions, why did this project, which received so many awards, inadvertently cause so much harm? And one way we could think about that is by considering the social ecological model, which says that the way that individuals interact with each other is different depending on what scale of society they're interacting within. And so, For example, you might respond differently to a proposed real estate project if you identify your role as a member of the community, even if by profession you're an architect or a real estate developer or a planner. And similarly, the kinds of conversations that are occurring within the local planning department are different from the design conversations that are happening within the real estate development team, because that group really has to figure out, how is this project going to generate enough value to make it possible to finance so it can be built. And so why does this matter? The breakdown we saw in the medical clinic allegory shows that the conversations at each level of society are not influencing the conversations at the other levels. And that lack of coordination is preventing the real estate sector from contributing to larger scale action on public health crises like climate change and chronic disease. And so Professor Castillo and my solution to that is something that we call architectural epidemiology. The idea is that architecture can be used as a mechanism for promoting community health if designers prioritize strategies that leverage the building's unique location. And that's thinking about both its natural and built environment, as well as its social and health context. It can maximize its co-benefits to the neighborhood and community priorities around climate change, population health, and social equity if it takes a sort of systematic and thoughtful approach to its context. And so this slide explains the process that's involved in applying architectural epidemiology to a building project, whether that goal is a new building, a renovation, or just simply changing the activities inside an existing complex. So the idea is that you analyze the baseline environmental health situation on and around the property. And that would take place in a real estate development process, probably during due diligence when you're selecting the property. For a design team, it would take place during the site assessment process, which usually right now, as I said before, what you're looking at are things like topography and how to access utilities and things like that. This is just an additional step that would be incorporated into that portion of the process. And as you're doing that work, you begin to identify what the exposure pathways are that could be effectively addressed by the design on this particular parcel of land, and specific to the kinds of activities that are going to happen in that project. We consider the mediating factors, which is a combination of the design strategies that we would use, as well as what kinds of groups of people are either going to be on the site or in the surrounding neighborhood who are at higher risk of negative health outcomes related to those priority environmental health exposures. And then we use that information to prioritize what we're going to work on, which health outcomes we're going to focus on. And so we call this approach architectural epidemiology because it draws on components of both environmental and social epidemiology. And so for those of you who are not epidemiologists, environmental epidemiology basically maps exposure pathways from an identified set of environmental hazards all the way through health outcomes. Social epidemiology, on the other hand, maps the social and the social and economic forces that increase the risk of certain groups of people having negative health outcomes. And so architectural epidemiology draws on both of those types of epidemiology to propose that building design and operations are fundamentally social activities that can be used as a mechanism for disrupting those negative environmental exposures and removing barriers to health promoting activities like eating healthy food, exercise, that sort of thing. And so I'm going to walk you through our conceptual framework to help you kind of visualize the interplay between these two types of epidemiology methods. So the top bar is looking at environmental epidemiology, and the bottom is looking at social. So just like with any kind of environmental epidemiology method, you start by looking at the environmental hazards that are relevant to that particular location. And then you also look at kind of the larger socioeconomic and political forces that are leading to inequitable distribution of disease in that community. You then look more specifically at the site and see what kinds of exposures, like how are people being exposed to those hazards? So like if the hazard is heat, for example, are you located in a place where there just aren't that many trees? There's not much vegetation. Are you in a floodplain? Who's getting flooded on a regular basis? And so then you start looking at the social factors. Where are different groups concentrated in that neighborhood? And then you look at the built environment determinants of health, which are kind of categorizing the specific elements that your project might be able to change or at least modify through smart design. And those are the baseline conditions that you're working with on the top half. On the bottom half, you actually map where are the socioeconomic and demographic disparities within that baseline environment. Are they inside your property line? Are they outside your property line? Are they both? Are there different vulnerable groups inside and outside? And then you look at those two mediating factors. So your point of intervention in the case of architecture is a design and development project, right? And so what are the potential design and operation strategies that you could use as sort of a public health intervention to disrupt that line that's moving from environmental hazards all the way over to the right, which is going to be health outcomes? What can you do to disrupt it? And who are the particular people, groups of people that you really have the ability to help through the design process on that site? And then finally, we get to the end, which is hopefully, if you were successful, you change the risk of poor health outcomes and the probability of positive health outcomes. I'll just add to the two ends of this conceptual diagram are that design and operation strategies can happen at many different scales, from micro scale inside the building all the way up to the international scale if you start thinking about policies. And then the time frame in terms of, how fast will those health outcomes change could again be immediate. Like if you, let's say, shut down a freeway within 2 days, probably you don't have that exposure to air pollution, to long-term exposures and health outcomes. So I want to kind of share how this conceptual diagram has been implemented on real projects, or at least on pilot projects. And so this is the way we've been doing this is kind of in a two-step process. The first step is a data analysis of the indicators or metrics that help you define the context within which you're working. So in the US, we have access to a lot of estimates at the census tract level that have been made available through federal agencies. And so by looking at the census data from FEMA has climate change risk data. The CDC has put out chronic disease and mental health prevalence estimates down at the census tract level. We can actually map out around a site what are the potential considerations that we should be looking at, whether we're talking about vulnerable populations or we're talking about environmental exposures. And then we rank them in terms of risk. And that risk would be, is this census tract, for example, we have obesity as low risk because this particular census tract, the obesity rate amongst adults is about average for, in this case, the city of Boston. And so it wasn't seen as being particularly like the thing that we would really want to prioritize for this project. On the other hand, you can see at the top in high risk, there's actually a metro stop across the street from this project, and there are a disproportionately high number of pedestrian injuries and collisions that happen as people try to cross at that corner to get over to the metro stop. And so it was identified as a dangerous intersection by the city of Boston. And so we identified that as a high risk. So just to give that as an example. And then once we've compiled all this information, we ask stakeholders, and those stakeholders include the design and real estate team. They include the community itself, as well as local government, to say, does this picture that we're painting for you using all these data sets make sense does this resonate with your understanding of that neighborhood and the way that this individual project could have a positive ripple effect on the surrounding neighborhood, or would you change things? And you can see in the picture, people actually changed the diagram in real time. And so what we end up with is I guess a sort of a logic model type diagram that walks over from the left-hand side of different indicators of high risk. This is a project example from Austin, Texas. You can see that it was this blue space. It's called the Miller redevelopment, and it's right next to a freeway. This is kind of this yellow line right here. And on the left-hand side is sort of central Austin. And the property itself was designed to be mixed income, diverse, attracting a diverse set of residents, child friendly. So a lot of people try and sort of emphasizes active living. There's a lot of parks and recreational places, and you can hike and you can ride your bike, and et cetera. And so people try to get across that freeway from central Austin on their bikes and walking. And so you'll see in this middle section here that it is identified as unsafe for pedestrians, that was something we wanted to focus on for this project. For the climate change and health exposures, air pollution is one of them because it's next to the freeway. Extreme heat, because it used to be an airport, so it's something that has a lot of impervious surface or concrete. And then it's also in a floodplain. And then finally, those social determinants of health that I shared before, those are 3 groups of people that are at higher risk of negative health outcomes. So it's important to design the project to consider how we can protect them. And so what we ended up doing was by looking at the public health literature to say, how do all these different high priority topics relate to each other and influence each other? We can actually prioritize down to a design that really focuses on bike pedestrian injury and death, or preventing it, reducing risk of heat-related injury and death, and reducing exposure to air pollution. And then we go back and look at that big library of strategies that are evidence-based, and we can say, well, these are the ones that align with our high priority topics. And we can also, because they come from these best practice guides that are require measurement, we can link them over to the city's goals around climate change, around multimodal transit, around air pollution, and we can demonstrate how this individual project is actually contributing to those goals. And I'll show you that in a little bit more detail in a second. So what's the outcome of this approach, which is very different from the way that we normally design individual architecture projects? So the first, if we look at the lowest scale, kind of the smallest scale within our social ecological model, stakeholders. The owner and developer are happy because they're able to complete their project on time and on budget, because they have they've gotten the buy-in from the community. The community is actually supportive of this project. Why is the community supportive of the project? Because they feel like their voices were heard and that their priorities were incorporated into the project. And they think that that the project will improve their neighborhood quality of life. The local officials are also happy about this because this project can actually measurably contribute to different policies that the city is following and compiling in their annual reports. And at least in the US, usually those reports do not include private property because they don't have access to that data. And so this is an opportunity to massively increase the data set that the local community is able to incorporate into things like their climate action plan, their community health needs assessment, et cetera. And they're also happy because their constituents are happy. If we look at the community scale, as I mentioned before, we can actually identify how this project contributes to a number of different policies. So you can see the mobility plan. This is their green building program. Of course, many of the design strategies that were prioritized here came from that building program. Their climate equity plan, their resilience action plan, and their regional air pollution plan. So it shows the city how this project is contributing to those requirements or those goals. And then if we then move up to the global scale, it also helps the city demonstrate that it's meeting its self-imposed requirements around the Paris Agreement in 3 different ways. So many of these design strategies you can see actually contribute to the goal of net zero climate change mitigation. Also adaptation, which has been a harder thing to measure, and because it's really site specific. So this approach allows us to kind of take a more evidence-based and data-driven approach to what kinds of adaptation strategies make sense for each individual real estate development project, and how does that contribute to these larger systems around community adaptation and resilience. And then finally, pretty much the entire process of understanding the context, the neighborhood context, supports the Paris agreements, and particularly this most recent COP's intention to integrate health into all climate action. And it does it in a measurable way. And then finally, with the Sustainable Development Goals, it kind of moves us beyond sort of just looking at like the letter of each objective to say, you know, okay, 6 of them mention adaptation. 1 of them really mentions climate change mitigation, which is number 13. But this project in Austin actually contributed to almost half of them. So thinking about that as an opportunity to really kind of scale up how the world starts addressing and trying to meet the Sustainable Development Goals, one project at a time. And so I'll just close by saying, you know, if we go back to our allegory of the medical clinic on a hill, imagine if instead of just looking at kind of how the interface right there at the edge of the property line and how this project is going to fit into, at a minimum level, sort of environmental systems and the kind of utility infrastructure of its surroundings, but was to actually really consider what are the health needs of the population who will be inside that property and the people who are already in the surrounding neighborhood. How will they be impacted by this project, and what could this project do to have the most co-benefits to every individual, whether they're inside the property or outside. And so you could imagine a project that, instead of causing all of those unintended harms, in fact, increased access to fresh and healthy food, that actually reduced flood risk within the neighborhood, and that actually worked within the city to find a way to increase access to multimodal transit and safe ways for children to get to and from school and to spend time outside and be physically active. That all could have been part of the conversation if this kind of environmental health scan and community engagement process had taken place. So I'll end there. These 2 websites are the website for the book, and architecturalepidemiology.org. And for those of you who want to kind of play around with the data that I showed that was kind of in the background, you can go to alignmentprocess.org and you can access all of the data sets. There are a number of demos in that website. So thanks so much. I'm really looking forward to this conversation. And again, I appreciate the opportunity to share these thoughts with you today.
Thank you, Adele, for your wonderful, wonderful presentation. Very clear and interesting how architectural epidemiology demonstrates the power of data and the power of stakeholders. So I look forward to the questions. Now I'll pass the mic over to Carme.
Well, I would like to start being very appreciated to be here in this discussion with so many people here. I have to say that today I don't feel very well. I will try to do my best. And I think that I will explain what we are doing as a group of housing and health in the Public Health Agency of Barcelona. Probably my presentation can complement the presentation of architectural epidemiology. I think that we are focusing in another point of view, but probably they are complementary, and we can discuss different points in common or not. The next, please. Yes. Well, first of all, I think that when thinking about housing, that our group is housing and health, it is very important, at least for us in Europe and in Spain, focusing in the structural determinants of housing, because we know that housing policies and the market are very, very important to understand what is happening with housing and what is happening with health, because it's related. Housing is a determinant of health. And then I have put here, as housing policies are very poor in Spain, then the housing situation in our country depends totally on the market. And depending on the market makes the situation that accessibility is very difficult. And not only accessibility to the house, also to improve the house. If we want to have a house with quality, if you cannot afford it, then it's impossible to do that. Therefore, I think that we have to understand that in order to understand what is happening in housing in our country and other European countries also. And I think that in US is not so different. The next one, please. Here you can see, for example, different countries of European Union, the percentage of the houses in social rent. And you can see that, for example, España, is the third one at the end. It's only 1.5%. This was 2017, but that has not changed. We have less than 2% of social houses, public houses. Therefore, all others are related with the market. And this is a problem very important. You can see that other countries of Europe, as for example, the Netherlands, they have 30%, Austria 24%, but for us, the situation is much, much worse. The next one, please. Here you can see the percentage related to GDP, the percentage of expenses to housing in Spain in the different years. And you can see that this is very low. It started in 2007 in this table. It was 0.4%, and it decreased, and now it's starting to increase again. But it's very low, less than 1%. And also you can see at the right side, the political party. Partido is political party. And when it puts PP, two Ps, this is the right-wing party. And you can see that during the years that we have had a right-wing party, these expenditures have been lower and lower. The 4 last years, we have had a socialist party again, and now they are increasing, but still we are very low. And therefore, with these numbers, it's very difficult to think that the population has accessibility to the house. The next one, please. Here, you can see the percentage related to total income of the households, the percentage that is related with the rent of the house. And we are the second one. This is European Union countries. We are the second one. It's 45% of people who live in cities, and it's 32% of people who live in rural areas. These 45% are people who have to spend more than 40% of the total income, more than 40% to the house. Then it's half the salary, half the incomes of the house for the house. Therefore, it's very difficult to have the possibility to have income for other aspects if you have to use all this income for the house. The next one, please. Well, this is our framework, the framework that we use for housing and health, and also many things that have been said before. We agree, we have not so different conceptual framework. We have at the top the main aspects, as I have talked before, housing market and housing policies. They are very important to understand all other things. And then we have also these welfare state, income policies, labor market policies, and I would add now environmental policies. I think it's necessary to be added. And then all of these are related with the access to the house. And then we have these 2 blocks in orange. One is the dwelling, and the other is the neighborhood. The dwelling, we have the legal and economic and emotional conditions of the home, and the physical conditions of the house. Physical conditions that, as has been said, are also important for climate change and for having a house in good conditions. But you need to have income to do this. And the neighborhood, as has been said, built environment and also the community are also very important in order in this conceptual framework. Then we have the inequality dimensions, social class, gender, race, age, and other. Access of inequality can be. And then health outcomes. Mental health is very important, mental health, mainly for accessibility, and then other health outcomes. The next, please. And here you can see the main topics that our group is focusing. The first one is housing insecurity, and we are working with the community who have problems with accessibility to housing. People who are, for example, the platform affected by the mortgage. You have to take into account that during the financial crisis, 500,000 people lost the house. Therefore, it's very important. We have been working with them in order to understand which are the mechanisms that can explain the relationship between not having a house and health. And we have worked also with Caritas, that is an NGO. And then we have worked with the Barcelona renter unions. And I think that to work with the community, people who have problems in accessibility, in order to put health also in their objectives is very important. And all of this trying to understand the mechanisms. Then energy poverty. I will show just now 3 or 4 slides on energy poverty, because energy poverty is also related with architecture. Not only architecture, but also architecture. And we have been studying, Laura Oliveras have had a PhD on health status of the people with energy poverty in European Union and also in Catalonia and Barcelona. We have also a project in cooperative housing, because cooperative housing, co-housing, is a way to try to cut, I don't know if the word exactly is cut, but is a way to go beyond the market, because if cooperative housing is not related with the market dimensions, then it can be a novel type of housing that can be an alternative. It's not the good alternative because it's not public, because we don't have the public money to do that. But cooperative housing can be a possibility. And we have been studying how cooperative housing is also improving the health of the community who live in the cooperative and people who live inside this cooperative. And then also we have been studying gentrification. How, for example, touristification, as you know, Barcelona is a city with how, as many other cities in the world, with a lot of tourism, and this is related with gentrification, and this is also a problem for the house, for the neighborhood, for the population. And to understand how health inequalities and gentrification are related with the population health. Well, now I will just show the next, please. Well, this is another conceptual framework. It's the conceptual framework on energy poverty and health. And this was prepared by a project that the name is PENSA. And it's more complex, but also you can see the structural determinants and the axis of inequality. Then the intermediate determinants related with fuel poverty, as for example, to have low incomes, to have high energy price, and also that the dwellings are not prepared, the architectural of the dwellings are not prepared to protect for the cold or warm of the population. Then the 3 aspects are related with fuel poverty. And then fuel poverty is related with dampness, all different pathways that are related with health outcomes. And, well, I will not explain all the framework, but you can share the presentation, and it is published, and you can see it also in the website. Next one, please. And for example, this is fuel poverty in Barcelona. In 2020, 9.4% of the population cannot afford to maintain the dwelling at an adequate temperature during cold months. 11% during hot months. As climate change is going on, hot is more important, and more we have problems with hot in summers and other time of the year. And also another indicator of fuel poverty is that 13.9% of the people have one or more arrears in utility bills in the last 12 months. They cannot pay the bills because they cannot afford them. Then, if you see here, there are different, this is full poverty for different axes of inequality. For example, age, women and men, you have women at the left side and men at the right side. And you can see that, for example, for women, those who have 65 and more have more full poverty, 15%, compared to 12% of those who are less than 65. People from low-income countries have 24.7% compared to 10% of people who are from Spain. And taking into account social class, manual groups of women have 22% compared to 6% of women who are of non-manual social class. You can see the results for men at the right side. They are not so different. And then here is the map of Barcelona, and the higher places of fuel poverty are the same as related with economic deprivation. Therefore, fuel poverty is related with economic deprivation. It's a problem that is related with social inequalities and social inequalities in health. The next one, please. And here you can see for adults how energy poverty is related with poor perceived health, poor mental health, poor quality of life, chronic conditions, domestic injuries, use of health services, and use of medication. And in the figure, you have for women and men two indicators, poor mental health and poor self-reported health. All these indicators are collected through our health interview survey. In Barcelona, we have a health interview survey every 5 years. And you can see as the difference that people who have energy poverty in orange color have higher values compared to people who do not have energy poverty in violet color. I think it's violet, pink, I don't know. But you can see that it's very, very difficult, very different. The percentage, the prevalence of poor mental health or poor self-perceived health of people who have energy poverty compared to people who do not have it. Next one. And this is related with children. Also, you can see children, 10% have energy poverty, live in energy poverty. And here you have 4 indicators comparing also those who have energy poverty and those who have not. And you have poor general health, poor mental health, asthma, and overweight. And for the 4 of them, you can see how health is much worse on those who have energy poverty. And I think this is the last one, yes. Just energy poverty is an example of the lack of public policies related to housing and health. Also is related with architecture because it's one of the items related with fuel poverty, not the only one, but it's one. It is very difficult to advance in housing and health while housing depends totally on the market, because therefore we have many problems with it. And it is necessary to put, sorry, this is not correct, to push housing, to put housing as a priority in the political agenda. And I think this is the last one. Thank you very much.
Well, Carme, thank you so much for that excellent analysis and presentation, especially on a day when you're not feeling so well. So we appreciate it especially. I'd like to just remind people that we are collecting questions, and we'll turn to that now. I'm struck, Carme, by what you said. Your analysis reminds us of the importance of data. Again, in the same way that the architectural epidemiology framework does, how important it is to ensuring equitable, in your case, equitable outcomes and access to housing, but in Adele's case, improving health outcomes and environmental outcomes. So we have a couple of questions. I'm going to start posing these questions to our two participants, but please feel free to continue to send them in. So Tom Lent has a question for Adele, and I'll just quote here: Adele's approach seems very powerful, but Tom would like to see some examples of changes made, A, during the planning phase, the initial phase, based on the data analysis, and then B, during the subsequent follow-up phase, during the stakeholder discussion. So Adele, a couple of examples of what you've learned from the data and from the stakeholders.
Sure. So we ran 3 pilots with projects. Mary was involved in one of them last year in the US, and they were in Buffalo, New York, Albany, New York, and Waterford, Virginia. And to give you an example from Buffalo, that was a urban farm and wellness center that was in a low-income neighborhood that had a lot of empty lots and was in a pretty dangerous neighborhood. It was a nonprofit client, and they were interested in, providing, it was also in a food desert. And so the idea was they'll bring the urban farm to the food desert and turn it into something that is integrated into a kind of more preventive healthcare system that a lot of low-income people in the US have a hard time accessing. And so in the wellness center, they were aligning complementary services with their community health clinic that was about a mile away. And so that it was trying to kind of be this sort of holistic neighborhood community center that would bring people out of their houses and hopefully catalyze more people on the street, which is something that evidence has shown can reduce violent crime in particular. And so as we were looking at the data with the different stakeholder groups separately, the architecture team and the developer in particular were really struck by the kind of aspects of the data that they hadn't thought of. They had been very focused on access to food, but we realized that the property was really close to a hike and bike trail that was going to be converting an old railroad line that was about half a block from the property. And that they realized that this is something, the property was on a major bus route. And so the idea was that this is something that if they redesigned the property so that it made it easier for community members to essentially travel through the property on either walking or biking to get to the hike and bike trail, that would be kind of an extension or amplification of their original idea, which was mainly bringing people into the community center for preventive screening, as well as giving them access to healthy food. So that was one thing that happened during that conversation. And then during the, to answer B, part B, during the community engagement process, the conversation between the development team and the community members that came to that engagement, there was a lot of talk about, this is Buffalo, New York. We had this engagement about 4 months after a really horrible race-based shooting that had happened in that neighborhood. And there was a lot of trauma associated with that. It's an African-American neighborhood. And so there was a conversation about violent crime and young people, and how this property could be a place that would be welcoming to kind of 13 to 24-year-olds, provide them with potentially, skills and opportunities for work, as well as single mothers who are also in the neighborhood. So there was kind of this more, again, sort of through talking with people in the neighborhood, the conversation that had started with just looking at the data ended up changing the conversation into something that really this project was going to become more of a catalyst that would be a community beacon essentially for that neighborhood. So that's one example.
Thanks very much, Adele. That's fantastic. Let me continue with the. I'm going to bring together two questions that are sort of addressing a similar theme that I think Carme also picked up on. So I'm going to pose this question to both of you. First, Julian Martinez says how to balance/integrate the profit interest of project owners with the priorities of stakeholders. So that's obviously a clear issue. And related to that is how to, from Alejandro Naranjo, how to mobilize the construction industry and investors so that they're willing to participate in a more extensive and complex process. So this relationship between the private sector owners and the stakeholders. To touch on that, which I think Carme also talked about, the private sector interest and profit interest in terms of housing in Barcelona. So Adele, perhaps we'll ask you first.
Great questions. The pilot project that I was just talking about was organized, set up as a mixed methods research project where the main outcomes that we were measuring was value generation around, could you actually change the way that you approach community benefit design so that it actually generates value by expanding essentially the radius of where that value generation could be conceptualized to be created, right? So I kept saying inside the property line. Right now, where value is generated in the construction and real estate industry is exclusively inside the property line, almost always, not always, but almost always. And so the idea is, well, who's outside the property line? And are there ways that you all can essentially share resources so that whatever is happening inside the property line is benefiting people on the outside who are then, giving back to the developer and construction team who the time frame that they care about is the construction loan. They need to be able to pay back their investors and, either sell or rent their property when the construction's over. And so the way that we did that was through that stakeholder process. So we explicitly worked with the different stakeholder groups to figure out what did they care about, where was the overlap in what they cared about, and then could we come up with an agreement where the way that the project was designed was benefiting the neighborhood in the ways that they saw as being tangible and immediate, in such a way that then the neighborhood would support the project. And so we had in two cases, community members say that they would go to the city council and advocate on behalf of the project being rezoned. Because right now the project was not going to be built because it was in a location where the zoning would not allow for the activities that the developer wanted to do on that site. That is an existential threat to the developer. And so the fact that the community was willing to do that was a huge value add to the developer. And then from the local government's perspective, that's where this question of, we're connecting, for example, to the hike and bike trail in that Buffalo plan. That is something that if posed to the local government in the right way, you could say to them, well, if we're going to do that, why don't you guys pay for the pathways that we're building through our site and actually reduce our construction cost? Or maybe you could, provide some concessionary, property tax relief for a period of time in response, for the service that we're providing to the community. So that was the kind of conversation that we were having through these projects. And we got to a point with them, they were demonstration projects, so we didn't actually go all the way through construction, but we did get to a point of agreement with all three of the projects. Some of them were more kind of tangible with actual deadlines and measures. Others were a little bit more kind of agreement in principle that then those stakeholder groups, and Mary's was part of this, have continued those conversations since and have found them to be fruitful. So that's one answer to your question. I want to stop here because I want to give Carme an opportunity to respond.
Thanks, Adele. I'll turn it over to Carme, but I'm struck by two things that Adele says that seem simple, but that are very, very profound. One is where there's overlap and what the stakeholders cared about. I think so often we forget that, we can really seek that overlap and work towards it, as you so well explained. And then how to extend the benefits from inside to outside. So you gave some very, very nice example of that. So Carme, any thoughts that you would like to add?
Well, I think that our experience with cooperative housing is not exactly the same, but they are owners. They are owners of their cooperative. Therefore, working with them, and they work also with the neighborhood, trying to be inside the neighborhood, and they trying to construct houses, prepare for the climate change, prepare for all the new things that energy poverty, all these kinds of things. I think that it's a good example. They are a group of people. They are interested in having a good house. They have to pay for it. That's not easy. That's very difficult. But they try to do a different kind of business because they don't have the possibility to earn money because the house is paid exactly what it costs, not more than that, because usually a house, they cost more than the cost of the building. And I think that this is a good example of how a group of people, they have the possibility to own all the house of the cooperative, for example, of 30 people. We have cooperatives of 30 people, and how they try to advance on all these aspects that then are related with health outcomes. And we have seen how many of them, before going to the cooperative, for example, they had energy poverty in the house where they lived before. And now they don't need to warm the house because the house is so well constructed that they don't need to warm it during winter. And that's very, very good. And I think it's a good example. But we do not have experience with profit owners in general because house for us is just a way to earn money, and therefore it's not easy to work with this kind of people.
Yeah, and I could actually answer.
Please go ahead, Adele, please.
The other half of the question, which had to do with how can we mobilize the real estate and construction industry to engage in this more involved stakeholder engagement. I have to speak here entirely from the U.S. perspective. I don't really have any experience in Europe, so I'd love to hear Carme's response to this. But basically, in most so the U.S. is set up in everything's local. All of the building codes are local. So, but in many local jurisdictions, particularly large projects are required to have some kind of community engagement. It's a requirement in order to get your construction permit. Usually that is something that happens very far down at the end of the design and is kind of set up in this scripted way that is trying to just get buy-in from the community, but isn't really getting feedback from the community. Most of the time, that kind of feedback happens when you're developing like a neighborhood plan or a comprehensive plan, and it's entirely in the public realm. When a private developer is trying to get their construction permit, they just want to go as fast as they can, and they want to interact as little as possible with the community and also with the local government. So what we were arguing with this project, and we've received some good feedback on this topic, is that the approach that we're taking is both more engaged with the community, but it's within a very clear framework, which is the structure of the health situation analysis itself, the data analysis. And so it allows for that conversation, like I was talking about with Buffalo, where there's a wider range of topics that are talked about. But if you want to bring in something that wasn't talked about in the original health situation analysis, for example, neighborhood violence, which was in public safety, which is not something that was in our original analysis, we then had to go look for that data and we incorporated that into it. So it's not something you can just sort of say, I woke up this morning and this is something I care about as a community member, so I'm going to go in and like shut down this project, right? And so as a result, we've been saying, this actually reduces the risk for the development team because it sets parameters around which you have this community engagement. On the other side of it, it actually provides for more direct input from the community. And so the community ends up feeling like they're more engaged. And so this is a process that we're recommending happening at the early end of requesting the permit and as part of that requirement that's already there for community engagement. So it wouldn't be an additional thing. It would just be instead of one of the other community stakeholder engagements that you're required to do. We haven't had that actually happen yet, but we are talking to a number of jurisdictions right now about piloting that approach.
Great. And I guess what you're saying, Adele, also is that it comes more upfront instead of sort of being at the end of the line, that you try to get it up front. Okay. Liz York, I think, has a question. She has her hand raised, and please, Liz.
Oh, I'm sorry. I didn't realize I had my hand up, but this has been fascinating, and I'm sorry I don't have a question.
Well, we're glad you think that it's been fascinating. That's are there other questions? I think we can allow people to raise hands and ask if they would like to. So please feel free to do so, and I'm going to rely on Ave to guide me as and when people have questions. I think Dr. Vicente Navarro has a question. Would you like to, Vicente? Would you like to speak? Would you like to? Hello, welcome. It's so nice to see you.
Yeah. Oh, it's such a. Do you hear me well?
Yes, we hear you.
Oh, it's such a fantastic session. Absolutely fantastic. I'm really delighted, and I hope that Hopkins is listening to that. Anyway, I'm calling from Baltimore. Anyway, just an observation and encouragement in the fantastic work you are doing. It's fascinating, both the conceptual frame that you, my good friend and student Carlos, have done, and that, and also Carmen was excellent. The point of the political determinants, I think, is very, very, very important. And I know that it's very difficult, it's a touchy issue, it can have some consequences and so on, but the political determinants are critical. Okay? So, and the fact that even in Spain, in Barcelona, well, I think that the data, the interesting data that you presented, Carmen, the one that where it shows how behind Spain is in terms of public housing, I think was for Spain. Is that true? It was not for Barcelona, for Spain, and related with the political parties, where even over one period that the socialists were governing, were not doing much, and then they did it suddenly. You see, so that is also extremely important. And I know, particularly in the United States, to touch the political determinants, always you have to be very, very, very courageous sometimes to do it. But it's necessary. It's necessary. And that is why I think, Carmen, fantastic information as well, in terms of look, who governs, produces that. And we never do that. WHO is typical. They never touch on that, understandably. But academics, we should be a little more courageous. And I think it's fantastic what you're doing. Great. An applause.
Thank you. And for those of you who don't know, this is Dr. Vicente Navarro, who is emeritus professor at Johns Hopkins University and has been for many decades one of the great world authorities on political and social and economic determinants of health. We're very, very proud and grateful to have his presence in the seminar. Would other questions, either by raising of hands or by putting your question in the chat? We have a little bit of time left. While you're thinking about your question, I would put a question to both Adele and to Carme. So data is so important to this approach, to the architectural epidemiology approach, and also, Carme, to your analysis and any kind of equitable outcomes for housing or other types of architecture. How do we think about countries that have data, that don't have data of the quality that the US and Europe do? We have lots of need, for example, in cities we know, and especially as climate change is moving forward, many hazards that are facing cities, and very poor data often. How can we use this as a tool to help improve data?
Do I start? Yeah?
Please go ahead, Carme.
Okay. Well, I think that data, one aspect very important for me are health interview surveys. Because health interview surveys, if we have the capacity to include the questions necessary, that will be very good. For example, access of inequality, social determinants of health, climate change. All this data can be included in a health interview survey. Therefore, I think that this is very good. But also it's important to have qualitative data. We have been using, for example, just as an example, in the platform of people affected by the mortgage, we have been using photo boys. These people, they did photographies of the situation. We asked them to do photographies of the mechanisms that were related with health. And for example, they did a photography on the meetings they had with this platform, because for them, this platform is very good to improve their health, because the platform helps them not to blame the victim, because usually, you have lost the house because you couldn't pay it and you had a mortgage and this is your fault. And the platform tries to understand them that the banks have had a big fault in this crisis. And for this, they tried to show with the photography that this was very good. Another photography was, for example, suitcases in the house. And these suitcases, some of them said, I have always the suitcases prepared because if the police come, we have to go because we will have been evicted, because these people usually are evicted of the house because they cannot pay. Well, just to say that this kind of other type of data, as for example, photo boys in this case, but can be groups of discussion, can be deep interviews. I think that all this data also is very helpful for us to understand the mechanisms, because we need to understand the mechanisms.
Great comment. Very helpful. Yeah, absolutely. Adele, would you like to add anything?
Sure. Yeah, that was such a powerful example. I think one of the things that we struggle with in the U.S. is bringing a face and sort of a whole person to people who are experiencing difficulties, and so that to comment before about political forces, it can start to neutralize some of the more the policies that tend to group people and sort of other them and make them less important. So bringing out their humanity, I think, is really important, and also helps you get into a house, because that's one of the problems with, at least in the U.S., with local officials, is they're not allowed into anyone's house, and that can be a problem unless they're invited. And so that can be a problem understanding what actually is going on. And so what are the environmental triggers to, say, asthma, or how do you even know if people are experiencing, temperature extremes within their property? So that's really a great example. I would add just a few kind of examples of projects that I've heard of. For example, there's a number of companies in the US that have been using people's phones so that they can take photographs to say, there's a pothole here, or, this is a place where we need help with the infrastructure improvements. That's more kind of seen as like a way to provide feedback to their local government, but that it could be used in the type of setting you're talking about, Mary, to gather data on the physical environment and also the social environment. That type of app, I think, could be really useful. Another is that there are some researchers looking at using mobile phone information about where people are moving and at what, real time to kind of figure out how to move populations away from danger during environmental events. And I could see that type of kind of big data processing being used also kind of over a longer period of time to kind of think through how should we redesign the resilience infrastructure within a community to kind of protect people. If like a whole neighborhood's evacuating when anytime there's a tsunami coming, then like that should tell you something that maybe there's something wrong with that neighborhood, right? And then I guess the final thing, or I guess two other, one is that we do have a lot of satellite data that will give us environmental information. So I think to Carme's point about the health surveys that we have, like in Africa, for example, you could combine those environmental satellite data with those health interview surveys to create some general kind of more blurred vision of what's going on in a community that could be used. It wouldn't be as detailed as what we have in the US, but frankly, what we have in the US is an estimate anyway. So who knows how accurate it really is? And I guess the last thing I would say is that I can imagine a future where generative AI is used to, if we were able to say, take the type of process that I was proposing today and use it on a whole bunch of projects and say, this really is working, we could potentially, take the kind of structural relationships between the different data sets and apply them to these more data scarce locations using generative AI and see if that would work. But it would be a process.
Very interesting. Thank you both for those comments. I know that in my field, in looking at climate hazards and impacts on disasters in cities, we're seeing cities begin to use smart sensors and AI to think about building that kind of data and and early warning systems. So very interesting. I'd like to go to, I know Tom has his hand up and we'll come right back to you, Tom, in a moment, but I'd like to go now to another question from Julian Martinez, who says, what were the main lessons from COVID-19? Is it necessary to keep now for preventing a hypothetical next pandemic in the architectural field or policies of healthy buildings? So COVID-19 and how do we think about that in terms of lessons? Would you like to start, Adele?
Sure. I would love to also hear Carme's thoughts about that in relation to fuel poverty, because people were kind of trapped in their potentially unhealthy homes during COVID. And so how that related to, what would be a future pandemic response. But I think that COVID-19 on the one hand was a really useful test case for at least the architecture design world in the US about, I think that there was people like me who were talking about the fact that buildings were having an effect on health were very much kind of on the margins. And when it became clear that COVID-19 was an airborne virus and that pretty much everybody was getting it indoors, then all of a sudden buildings were the reason why we had transmission of COVID-19. And it's because of the fact that we don't open our windows, at least not in the US, right? And so that kind of began to change the conversation around really maybe it does matter that the indoor air quality inside buildings is not very high and that it's causing trouble, because pre-COVID, the argument was, well, it's reducing productivity. And if whoever it was who would care about productivity didn't really care about productivity, then they just ignored indoor air quality and they would basically reduce the airflow as much as possible to save on their electricity bill. So I think that COVID was a wake-up call to say that these are two things we need to talk about together. And it made it possible for those of us who were saying, yes, and think about, extreme heat and how that also relates to these topics, right? And that we're both causing climate change with air conditioning, and we also need it in order to protect people during heat waves, that this is a paradox that we need to find a way to deal with holistically, that was, it was useful. I think the other thing that was useful about it was it has increased the conversation in the US about forward-looking building codes. So right now, when you build, and when you size your air conditioning, just as an example, you use historical data. And so we know that the climate is changing, and in many parts, at least of the US, and I believe in Europe as well, we're seeing warmer and warmer and longer periods of hot weather, but we're actually building the capacity for 30 years ago, not for 30 years from now. So the conversation around like, how do we actually revise our building codes so that they're forward thinking? And maybe that we're building buildings that are resilient to multiple different climate change related disasters instead of focusing only on one thing was another way that COVID helped us, because we've begun to kind of thinking about how do we change ventilation standards in the US so that they were not really just there for the functioning of the building systems, which is basically what they were designed for, but that they should be there to protect human health as well.
Carme, what do you think?
Yes.
COVID and interior.
Yes, I think that COVID was a clear example of inequalities in housing because the lockdown show how people who have a big house, a garden, or a terrace have had good possibilities for the lockdown, and people who didn't have that had a very difficult time. If you have 2-3 children and you have 30 meters in your house, then it's impossible to be there all day. And I think this has shown, the COVID has shown the importance of housing for health. And now I think that people are thinking more about the importance of several aspects of the house as having, I don't know, something to go out, but it's not easy. In a city like Barcelona that we are so tight all together, it's not difficult. It's very difficult to have this kind of house. But I think that COVID was that example. We studied inequalities in COVID in general, in the infection, and we found mainly in the first and second wave, inequalities were very important by neighborhoods. In Barcelona, we have published that in the International Journal of Epidemiology. You can find it. And also now we are trying to publish some aspects related with the house, the type of the house, if you have there's a terrace, or you have more people in the house or less, and health outcomes during COVID, during the first wave. And I think that this is important to reflect how housing is affecting our health. And this is the most extreme case, because we were at home several weeks closed, and therefore the house was so much important. I mean, inequalities were very, very hard there.
Great comments. And yes, I think COVID showed us the importance of thinking in a broader sense about multiple hazards as well. Tom, please, you've got your hand raised, and I think maybe Ave can allow you to speak.
Hi, yeah, great. This is really an intriguing conversation, and I want to come back to one of what felt like some of Adele's primary defining concepts, that looking about where the overlap is inside and outside of the property line, between the interests of those inside and outside, and how, in response to my first question, you brought an example that challenged the property line. You brought an example that brought people from outside of the property line into and through the property, not necessarily for the initial primary purpose of the development, but to connect a piece of the community in a way that met goals that were at least peripherally part of the related to the initial goals of the project, but going beyond that and really responsive to community needs. And I think this challenge to the property line concept is really interesting. The word that came to my mind as I was hearing you describe that, and I was that case study and the principles there was permeability of the property line that has been so inviolate in our planning processes previously. In this case, permeability from the outside in, of the community coming in through the project, literally. And I haven't come up with any yet, but I'm guessing that it could go in the other direction as well. That the project could end up permeating out, just like we already in in some of the early stages of what you come to this through, through the things that you and I initially worked on in the Green Guide for Healthcare about the toxic impacts of the materials you use and some of the other health related impacts of the actual design of the project itself. But, I think that this may, extend beyond that concept too, that, that having a more permeable definition of what our projects are in the community and, may really help us think through the potential synergies that you're pointing to much better. So very, very provocative. Got any more extension on that?
Thanks, Tom.
That's
Well,
so
please,
interesting.
Adele.
Yeah, I hadn't thought about it that way, but I love that concept. I guess I'd say one thing. So Tom is located in California, and I've been working on some projects in California and noticed that comprehensive plans in a number of local jurisdictions are beginning to ask private owners to do exactly that, to make public access possible through their properties and to use the property itself, or at least a portion of it, as a public park. And whether it's and actually activate it in some way, right? So it seems like that kind of conversation is beginning. I haven't seen it anywhere else in the US, so it'd be interesting to see if that is something happening in California. The other thing I would say, just on a personal note, and I'd love to hear Carme's thoughts about this, is I spent some of my high school years in Barcelona, and first, I think, fell in love with architecture and urbanism there. And the Ensanche, like the central part of town, was originally designed to do exactly what you're saying, Tom, where you'd have like the buildings kind of around the edges of the block, and then there would be an interior kind of public space, and people would be able to walk through those blocks. And some of them have been blocked off, some of them are still open, and there's now this whole kind of like urban renewal where they're creating these super blocks where it's going to be all pedestrian and kind of connecting across one block to another. So I don't know, Carme, if you want to like reflect on what Tom just said from the Barcelona context.
Yeah. In fact, they are trying to recover these parts inside the blocks because they were very important in one moment, and now some of them have been privatized. Then they are trying to recover. But super blocks, yes, we have had these the last 10 years more or less, and we have known many of them. And this has been a little bit controversial because the super block is that many blocks that are together and cars cannot go in and you can walk, you are very well there. But what happens outside the super block? Then it's all the cars that are not in the super block are outside. And sometimes this has been criticized, but also we have studied health in super blocks. We have had a project on this. Catherine Perez has been the principal investigator, and we have shown how super blocks are very beneficial for health because people can work, people can socialize. They have other opportunities that it's very difficult if you don't have them, no? Therefore, I think that I like super blocks, and we hope that they will follow being implemented because the political party that is now in the government of Barcelona, sometimes they say that they don't like super blocks. Therefore, we will see. We will see.
Well, we have time for just maybe one or two more questions. While we're waiting to see if other questions emerge, I would make a comment and see if either Adele or Carme would like to add to it. I worked with Adele on the Waterford, Virginia example, case study. And one of the things that we found there that we haven't talked too much about was the response of the local government. The local government was their eyes were just opened. They said, this is wonderful. This is fantastic. We like being involved at the early stage. We never get asked to get involved at the early stage. getting us involved early on really helps us think about the needs and think about this building and this proposal in a different way. So I don't know if we want to maybe, Adele, reflect on that idea of bringing the local government in early and how important that can be.
Sure. When one of the things that I found most fascinating about the Waterford project was one part of the process that we went through involved looking at these evidence-based design strategies that were in that logic model I showed you guys, and then asking the 3 different stakeholder groups to organize them in order of priority from their perspective. What would be the highest priorities for that particular project in that location, given the fact that we had already identified some environmental health priorities that those strategies would contribute to, right? And the community group and the owner of the property came up with, I think there were 15 strategies. They were almost exactly in the same order. And the local government, they were exactly opposite. So like literally number 15 was number 1. And it really allowed for a conversation to start about, why, right? And why is it that on the one hand, the community and the owner were really emphasizing resilience and, letting water into this site. It's a mill, so allowing for it to kind of work with the watershed and that sort of thing. Whereas the idea, the initial response from the local government was, this is a historic building, so we need to keep it as away from the water as possible. So let's put up floodgates and, separate it entirely from the watershed. And so we were able to kind of facilitate a conversation there so that the local government began to see the property more from the perspective of the people who were there, the community and the owner, and slowly kind of started moving in their direction as they began to understand. And at the same time, I think, there was a clearer understanding from the community and the owner's perspective about why is it that the historic preservation delegates were, why is it they were taking the stance that they were, and that there was a lot to be learned from that, and that maybe we could find a way to do both. So that, to me, I loved that experience because it was just so stark to see how important it was to kind of share that information with the government early on, so that you didn't show up, asking for a construction permit with this like mill in the middle of like a lake or something. And they would have just freaked out. To kind of have that conversation early on was quite important.
And that gets to the point, Adele, that you raised of the overlap, and there always is an overlap, and in the process of dialogue, you can get to a point where that overlap is larger. So, are there other questions, other thoughts, comments from either Adele or Carme? Okay, well, with that, I will.
I just wanted to really say how much I appreciated Carme's perspective and bringing all of that local data to this conversation. I think it was incredibly important. So thank you for that.
We are complementary.
I agree. It's been terrific. I'd like to thank both Adele and Carme. The presentations were really very complimentary, but also very, very much in parallel. You both had a very nice structural, conceptual models to show us, to help us think about these things. Thank you both. I'd like to respond to Ellen Kahn, who asked about whether this policy dialogue will be available online, and it will be indeed, and that we will also have a report of it recording the attendees and the countries, as well as other issues. Thank you for your time, the people in the audience, and your comments, your questions. We've appreciated it. And just a reminder also, you can follow the center's Twitter or X, I guess, account to find out about future policy dialogues. And once again, we wish you, Adele, wonderful, best wishes with this exciting architectural epidemiology, and Carme, similarly, with your future and continuing pursuits. Thank you all very much.